Is this on? Okay, hello. I'm not sure where the little camera is, but I am going to show you how to use a soup spoon. Very cheap ceramic one. You can get it at a restaurant or hopefully at a cuisine place, but this is what I'm using. And you'll want to take the edge of it, the soft, like, but sharper edge in order to get a good massage going in the fascia, muscles, and all the different veins that surround the eye. And you'll take it like this and just stroke lightly. Usually, the oil of the face is enough, and you don't need to add oil or any external lotions in order to get a good motion going. And these are the structures or parts of the anatomy that I really focused on when I had my chalazion or blepharitis. And I would just go along, and you'll get inflammation. The skin will maybe turn red due to the local congestion and residual inflammation and build up. And so don't be surprised if you get like a little bit of like a, not rash, but some marks in response. And it really is a double whammy because you can do this along the entire face, along any wrinkles or points of tension, and it can help a lot with general facials and keeping up with the good skincare and cosmetic issues and things like that. It's important to do the opposite side as well because sometimes a contraction in one eye or issues in one eye can bounce back and forth, or they can just be a manifestation of the opposite side's disorders. So as you can see, like, you'll find that certain places are more sensitive than others, and you don't want to hurt yourself, but try and focus on releasing those points of sensitivity. So, after you stroke, do some gua sha, I call it like muscle combing. You'll want to do some nice circular kneading. Find the tender spots. There is a meridian called the stomach channel's divergent meridian that feeds down through the brow, and oftentimes if there is illness or an issue that involves the stomach or spleen, you're going to find that the eyelids and the nasal cavities become implicated, as well as the throat, mouth. Different structures can be afflicted. But this is the issue is that you can't really get a lot of gunk out of these glands because they're tiny. So you'll want to slowly knead through here, and you can use the gua sha directly on your eye. I did, but don't be too rough there. You can just gently stroke, and you'll find if your issues like mine, you're gonna get more dust and like expression along, especially out through here at the lateral corner of the eye, right there. So in addition to those techniques of massage and gua sha, just combing and doing some nice acupressure and even like pinching you can do along the brow, really get in through here as well. You'll want to get, I'm using Yogi brand Purely Peppermint, and we're going to pretend that I steeped it, or I, what do you call it, put it in hot water and all that. And this would be, saturated with pretty hot water, not enough to hurt you, but enough to like warm up the skin and really get the fluids flowing. And so once you get that steep it, and so you can actually drink the tea, because that's going to have a nice medicinal effect to release the exterior, as we say in Chinese medicine. And you're going to place it directly and add a little pressure, not too much, because that'll just cause more irritation to the eye, but just enough to kind of help express the swelling. And the peppermint itself might cool, it should reduce the local irritation. But if you do find that there is any issue with like increased irritation, remove it, flush it with water, and discontinue tea therapy. I don't think there will be a problem, but it's important that you know, just respond accordingly to your own issues as they arise. So do that a lot, especially before bed. You know, just putting the dry bag there, it made my eye feel cooler, and not in a bad way either. Those things are really what I did mostly. I did do acupuncture, so if you can get to an acupuncturist, they can do local stuff and they can do constitutional stuff that'll really help. There were points that I wanted to do on myself that I couldn't, um, and I lamented that. But the local stuff was done for the exact same reason as the massage, to move the blood, lymph, and different juices that are stuck there, to promote the um, release of tension and contraction that might be blocking the flow of the fluid. So that's really the issue that's going on here, that there's just been an inundation in that local area for one reason or another. The pathogenesis and etiology remain a little bit unknown to us, but you'll find that the cure is mostly the same. We just need to move the fluid. So I hope these techniques help you. I hope my video came in okay, and this is one of my first ones, so give me a break. Anyway, if you have any other questions about blepharitis or chalazion treatment from a holistic standpoint, just hit me up and I would love to help you.